Okay, continuing on with some other ethical theories, we also have virtue ethics, which focuses on benevolence and charity. It's a philosophy that was developed by Aristotle and some of the other ancient Greeks, and really is kind of a quest to understand and live a life of moral character, and hence the name virtue, or the goal of being a virtuous person. So it's a character based approach to morality and assumes that we acquire virtue through practice. By practicing, and you're practicing being honest, brave, generous, just, it's through that practicing a person develops an honorable and moral character. So, according to Aristotle, when you hone those habits, you're likely to make the right choice when faced with an ethical challenge. So, virtue ethics has been identified as the one that emphasizes virtues, as I said, moral character. And in contrast to duties and responsibilities, like we talked about for deontology, or the consequences of the actions, as we talked about with consequentialism. So, the virtue ethics argues that this virtuous behavior results from the character of a person and is the basis of an ethical life. But it's criticized because there's a lack of objective and general criteria of what is good. Again, we've come across that a lot. Who decides what is good? Who decides what is happiness, etc. So there's no general criteria of what is virtuous. So that's one of the challenges. And kind of, I found a really good example, I thought, of, to illustrate virtue ethics in comparison to the other ones that we've talked about. So there's a famous ethicist, Mark White, and Robert Arp. So together they did a look at illustrating different of the different moral philosophies. And they used the film The Dark Knight, where Batman has the opportunity to kill the Joker. Utilitarians, they suggest, would endorse killing the Joker. By taking this one life, Batman can save lots of lives. Deontologists would reject killing the Joker because it's wrong to kill, period. You do not kill. A virtue ethicist would highlight the character of the person who kills the Joker. Does Batman want to be the kind of person who takes his enemies' lives? And no, in fact, he doesn't. So, that's kind of a comparison to understand what virtue ethics is. Casuistry, and I'm guessing I'm saying that correctly, but from now on I'll call it case-centered ethical approach. This is where the moral insights come from analyzing specific cases and looking at, is there a precedent for a particular action? So it's an ethical reason that causes problems due to pressure to conform to societal, ethical, or unethical values, and it's due to a difficulty in applying general issues like resource allocation, etc., because it doesn't focus on rules and theories, but on practical decision making. Based on precedent. So what has been done before? Has this ever been done before? And what was the outcomes? So case-based would first identify what the situation is and then compare whatever is happening to similar situations that have happened before, prior experiences, and then to try to determine what the similarities are, but also what are the differences. So let's say a clinical ethics committee was asked to consider whether it's ethical for a healthcare provider to breach a duty of confidence, as we talked about before. That committee would identify key factors like the health risk to others if the information is not disclosed. Then it would look at similar cases. Has this ever been done before? What is the risk of not telling? So it's kind of a very fact-based, information-based theory. And case-centered really is something that shouldn't be used in isolation. So it's not a theory that is used in and of itself, but it's often used in conjunction with the other theories, consequentialism, deontology, etc. So, it kind of is a fact-finding looking at what's been done before kind of theory. Now, the ethical principles are things that you're probably more familiar with because we hear these terms all the time. And these are the principles that really govern healthcare and act as a framework when you're making healthcare decisions. When ethical dilemmas arise, the best approach is to think through these principles logically and methodically. So we generally know beneficence, and beneficence is the act of doing good. So it's balancing the benefits of treatment against the risks and costs. The healthcare professional should act in a way that benefits the patient. The other one that we know generally pretty well is non-malfeasance. That's do no harm. And it's the act of not doing something bad, avoiding causing harm. A healthcare provider should not cause harm to the patient, although we know that most treatment involves some kind of harm, even if it's minimal, but the harm shouldn't be disproportionate to the benefits of the treatment. So, use myself for an example. I've had 2 knee replacements. So in having 2 knee replacements, there's harm. You're cutting away, taking out my knee and you're, inserting an artificial knee. So there's some harm to the patient. However, my benefits, the fact that I can now walk without pain, is much more than the harm that was caused by doing the surgery. So in healthcare, practitioners have this ethical responsibility to strive to do what's in the best interest of their patients. It's important to remember that some of those medical interventions can be seen beneficial, but also carry with them the possibility of causing harm. So another example, aside from myself, is let's compare the two. So a doctor who has a patient who's in considerable pain, and he wants to prescribe pain medication to alleviate that pain. It's interfering with her function, etc. So the act of prescribing that pain medication to alleviate the pain is a beneficence, but he's concerned about the potential for addiction, and that would be non-malfeasance. Autonomy is another one of these ethical principles, and that's the right of the patient to make an informed, uncoerced decision about his or her own health care. If this principle is disregarded by a healthcare provider because the provider believes he or she has a decision that was better for the patient, then the term is paternalism. So think of that term paternalism being parental or being fatherly. So they're taking control. Healthcare should be an autonomous decision, and it should never, an autonomous decision, one that the person is capable of making on his or her own, should never be overruled by a provider. Sometimes a person is unable to make an autonomous decision, because to make that autonomous decision, they have to have the capacity to receive information, retain that information, and be able to repeat and understand the information that's given to them, provided it's given to them in a manner that they can understand. And that's another duty, is to provide that in a way that they can understand. Let me give you another example. Patient has prostate cancer and is given 2 treatment options. Can have chemotherapy combined with radiation, or can have a surgical removal of the prostate. The patient decides that he does not want the long-term implications of the prostate removal and elects to have the chemo and radiation. That's autonomy. He's made an autonomous decision. However, the surgeon and oncologist override the decision and decide that the patient has to have surgery. That's a paternalistic response. Consent is an extension of autonomy, and there are different types of consent. And you've probably heard these terms before. Implied consent is where the doctor assumes that certain actions or body language from a patient imply that the patient has consented to the planned action of the doctor. Expressed oral consent is the patient has verbally given permission to proceed with an intended action. And expressed written consent is that there's evidence that the patient has given a signature and given consent to a procedure. Written consent should always be obtained after oral consent. There's never proof of oral consent. There's always proof of written consent. And as a paralegal in a former life, I would advise you to always get written consent. So a fully informed consent is given after the patient has been given all of the information, and ideally consent is given both written and orally before any type of treatment happens. Justice is another of these ethical principles, and it's the distribution of things and positions of people within society. So in a medical setting, it involves the allocation of healthcare resources in a fair way. Now, fair is one of those terms that's important to pay attention to, because some people think that fair is giving everyone an equal share. And sometimes it is interpreted that way. However, the true essence of being fair is to give everyone what he or she needs. And I used to use this example quite often as an OT in a school setting, because I would be working with kids who had trouble, what's called regulating their sensory system. So they have trouble when they are taking information in from the environment. They have difficulty processing that information and being able to make what we call an adaptive response. So being able to appropriately respond to that input. And that often manifests in things like behaviors, jumping around, banging into things, some of the things that you think of with kids who have ADHD or something, very kind of hyperactive activities. So I would recommend strategies within the classroom and equipment within the classroom for the child to be able to do those things in a more appropriate way, so it helps them be able to regulate that input. So things like wiggle cushions or things like that. And I've had teachers say to me, well, if you give Johnny a wiggle cushion, then I have to give one to every child in the classroom. That would be fair. And I said, well, every child in the classroom doesn't need them. Johnny needs them. So, this concept of fair, I said, well, okay. And to highlight that, I said, well, I wear glasses. Does that mean that I should give every child in the classroom glasses as well? No, they don't need them. Same is true here. So you want to really think about, what does that term fair mean? Truth-telling is another one of these principles, and we call it veracity. And it's when a healthcare provider gives the patient all of the known information about their health, and allows the person to be fully informed and allows for those principles of autonomy and consent that we already talked about. But it's important to note that there needs to be, you need to consider the fact that some people don't want to know all of the information. You have patients who sometimes say, I just don't want to know. So it's important to ask if they want to know or not. And there is one extremely rare occasion when it's acceptable to not tell a patient the truth, and that's when the patient may come to harm as a result of being told the truth. So for example, if you tell me that I have cancer, I'm going to kill myself. So in that case, it's acceptable to not totally tell the person the truth if you believe that statement is true. Fidelity is an obligation to be faithful to the commitments that are made to the self and others, and involves loyalty, truthfulness, promise keeping, and respect. It's related, again, to the treatment of autonomous people, and failure to remain faithful in dealing with others denies the individuals the full opportunity to exercise free choice in the relationships and limits their autonomy. And finally, confidentiality, which I'm sure we'll talk about more as the semester goes on. It ensures that the information held about the patient is accessible only to the people who need to know, and whom that autonomous person is given full consent to know. So in order to achieve this trust between the medical professionals and their patients, you have to maintain confidentiality. And it can only be broken if the information shared by the patient refers to a potential danger to public safety or ordered by the court. So you have to keep, and we'll probably talk about what specific confidentiality is as we go along, but let me give you an example. So a doctor informs a patient that he has a seizure disorder, epilepsy, and really can no longer drive. So the doctor pulls his license. But on the way to work one day, the doctor sees him driving. So the doctor has a duty to inform the registry of motor vehicles that this person is driving. So although it's confidential information, for the person's safety and for the safety of others, that information can be disclosed.